About 600,000 people die of heart disease in the United States every year. That's 1 in every 4 deaths. According to the World Health Organization, 17.3 million people across the globe die from heart disease annually. In honor of Heart Health Month, TGMC and Cardiovascular Institute of the South are exploring the importance of heart health, signs of heart disease, and the best practices for staying heart healthy. Joining us tonight is interventional cardiologist Dr. Craig Walker and CIS patient Kim Waldrup.
All right, welcome to the program, and Dr. Walker, certainly thank you for coming by as always, and Kim, welcome to the program. And we're going to get to your story in a little bit, but we want to talk first to Dr. Walker. I know it's actually, as you've heard in the introduction, the American Heart Month, and I guess, Doctor, let's just kind of start. We hear the term heart disease. What can you tell us? What does that mean?
Yeah, it's a catch-all disease, Jimmy. You know, and it really depends upon how we look at it, because heart disease kills people in so many different ways. To start with, we have coronary artery disease, which are blocked arteries of the heart. We have valvular heart disease, which is another form of heart disease. We have electrical arrhythmias, which is another form of heart disease. And then we really have other things which are related. Stroke is a related phenomenon, certainly both to the rhythm and to blockages in arteries. Ischemic gut, or gut that starves, leg issues. So this is a huge problem. It's a problem that is overwhelmingly, nothing close, the leading cause of death and disability, and the most costly segment of healthcare.
Right, and in connection with that, I know a lot of people kind of think of it, or they may, just think that men are more, or only the ones susceptible, I guess, to heart disease. Is that an accurate statement?
It's not. It was traditional teaching, because men have higher incidences of epicardial disease. In other words, the big vessels upon which we do an angiogram and we see a blockage, men have a higher incidence of blockages. However, for the last 15 years in America, more women have died than men each and every one of those years. And there are many reasons for that. One, they present differently, and so the diagnosis is often missed. Many people would say because women have husbands and husbands have wives. When a man complains of a symptom, his wife says, you better get treated. When a woman complains, often it's ignored. Right. And so it's a different animal.
Yeah.
But no, it's totally wrong. In fact, both men and women have this problem. It has certainly become a major focus of mine in particular, because women are dying at an unbelievably high rate from this disease process, and going up at this point. Women have taken on habits such as smoking, which historically they did not. That is certainly a risk factor. Their diets have changed, their work habits have changed, and with that has come this disease process, and we have to do a better job with it. And
speaking of that, risk factors, maybe we can go over some of the the risk factors. I know some people know of them, but there's certainly probably some that we don't know. But tell us a little bit about the risk factors.
Sure. I think the biggest risk factor, and the one that people ignore the most, is family history. If your mother and father had heart attacks, watch out, because you're more likely to get them. My dad, as a farmer, used to say, when you plant butter beans, you don't get roses. And there's a lot of truth to that. Yeah. But there are many other risk factors as shown here. Age. This is a disease of senescence. The older you get, the more likely you are to develop atherosclerotic disease. We've mentioned family history. Cigarette smoking. One thing that is a misnomer. People believe, well, if you just smoke one cigarette, it's not such a big risk. That's not true. Cigarette smoking is directly related, how many cigarettes you smoke, to lung cancer and obstructive lung disease. But when it comes to heart disease, even minimal smoking represents a huge risk. Poor diet, and certainly we have challenges in diet in South Louisiana. We want to diminish how much salt we take in. We clearly want to diminish fats in our diet. These are, in particular, saturated fats. High blood pressure. High blood pressure is a huge problem. I call it the silent killer. Up to a third of adults in America have high blood pressure. And what's very interesting, when we speak to people about high cholesterol or high blood pressure, which they don't feel, they really sometimes try to just simply deny that they have a problem. They call it white coat syndrome,
Okay.
or they say other things. And the truth is, we know that it represents a big problem. Diabetes is a huge risk factor. High blood fats, being obese, not being physically active, high stress occupations, and poor hygiene. More and more, we're starting to realize a huge relationship between dental health and heart disease.
Okay, and risk factors, I guess that, are there maybe some risk factors that might affect women more than men?
I think the overall risk factors are the same. Still, I would say that there's no greater risk factor than a family history. If your family members have heart attacks, you should be cognizant of the fact that you're more apt to have a heart attack. It's just that simple. But all of these are important risk factors. Cigarette smoking is huge. Diabetes. Diabetes often stops you from having any warning symptoms because your nerves don't function properly. It's a huge problem. High cholesterol. Many people want to simply ignore this. I look at it like the ostrich who sticks his head in the sand, but
Right.
Unfortunately, you can't ignore it. And high blood pressure. All of these are important, and the more of these you have, the greater is the risk.
Okay, and you mentioned heart attack. Actually, what is a heart attack?
Well, a heart attack is when heart muscle, the heart is a muscle, and it's a muscle that contracts. It contracts at roughly every second for your entire life. It never takes a break, and if it takes even a 2-second break, you pass out. It never gets a break. But the heart is supplied with blood vessels itself. And when those blood vessels become obstructed to the point that the muscle dies, that's what a heart attack is. The other name for that is a myocardial infarction. So with that, heart muscle starts to die. That sets off a sequence of events that's very important. One potential event is that you can have arrhythmias, where the heart just simply quivers and is unable to pump blood around the body. Another is that you may destroy so much heart muscle, you don't have enough pump, you don't have enough horsepower, if you would, to pump the blood around your body. We call that cardiogenic shock. The third is that muscle may die, and it can actually blow a wall out of the heart muscle. And that also is a potentially lethal issue. So all of these things are what result in these heart problems and the end organ damage. That's why it's so important to pick this up before the heart attack, before the muscle dies. The best way to treat this is preventive, not heroic.
Okay, and I think what we'll do, let's get to one more question before we take a break, and that deals with how can maybe somebody tell that they're getting ready to or are experiencing a heart attack?
I think the first thing is index of suspicion. If you have a family history of heart disease, you should relate that to your physician. You should very carefully have your cholesterol and other blood fats looked at, your blood pressure assessed, a very careful physical exam, because you may have no symptoms at all and yet be at high risk. Certainly, if you have any risk factors and you have chest discomfort, shortness of breath, a decrease in exercise capacity, even heartburn, all of those things are important. Nausea is often the only sign that you're at risk of a heart attack. And in today's world, we have so many other things that we can do to pick up even the earliest disease. Things like calcium scoring, which is a very easy and not terribly expensive test. One can go into a CT machine for about 10 seconds. It's not much radiation, and it can tell if you're starting to develop atherosclerosis at the earliest stages, when it's easiest to prevent its progression.
Okay, what we're going to do, we're going to take a break. Thanks for that information. Kim, I promise when we come back, we're going to hear your experience, which I think is going to be very interesting, and we'll do that when we return.
It could be heartburn. It could just be stress. It could be a heart attack. To learn more about heart disease, go to the experts. Cardiac care at TGMC. It all begins here.
I'm a director here at the Little Theater in Houma. Sometimes I've acted, and I've even played in the orchestra. My name is Karen Schilling, and I was treated for breast cancer at Mary Bird Perkins at TGMC. Quality medical care and compassion should go hand in hand, and I definitely got that at Mary Bird Perkins Cancer Center. My doctors were incredible, and the technology is state-of-the-art. I believe that everyone at Mary Bird Perkins at TGMC deserves a standing ovation.
No matter their health care needs, whether it's cancer care, cardiovascular surgery, a sleep disorder, or women's imaging and breast center, more people choose TGMC for life. Terrebonne General Medical Center. It all begins here.
I'm 72 years old, but I don't let that slow me down very much. When I was having my radiation treatments, I played tennis the same day. My tennis partners couldn't believe it, but the treatments didn't hurt at all. My name is Teresa Betts, and I went to Mary Bird Perkins Cancer Center because I had a brain tumor. I had surgery and radiation, and I'm happy to say it worked. Oh, there was no question about where I was going to go for my treatment. That's why I'm back on the court, still working on my backhand. Thanks to Mary Bird Perkins Cancer Center.
It could be heartburn. It could just be stress. It could be a heart attack. To learn more about heart disease, go to the experts. Cardiac care at TGMC. It all begins here.